the coronavirus available to the public as quickly as possible. Though several other biotech corporations across the country are working on a vaccine, Young explained why the Novavax technology stands out.
So these other technologies that have been sort of out in front of us are technologies where they inject something into you and they expect you to make the protein and then make an immune response against that COVID protein. In our case, we make the protein in big fermenters. We purify it, and then we inject the purified protein directly into you. And so your body doesn't have to do anything. You just have to have your immune response.
Okay, Julie, we're ready.
Good afternoon, everyone. Thank you for joining us for our weekly Wednesday media briefing. To those who are on our Zoom chat, as well as those joining us on Facebook Live, we will begin this afternoon's remarks with County Executive Mark Ulrich.
So, good afternoon, everybody. I'm just going to talk briefly for now. Our news releases went out today, and I want to provide details on the county's amended executive order update on phase 2. Based on the data we're seeing right now in Montgomery County, we eased some restrictions and we tightened others. Our mission, as always, is to reduce the community spread of COVID. We have been informed by the work of the contact tracing and where they see a greater source of cases and where they don't see a greater source of cases. So the big highlights out of this are that some businesses will be allowed to reopen. And that'll include businesses that are providing services like tanning, tattooing, waxing, threading, electrolysis, cryotherapy, and facial and massages. All that's by appointment only, and all of that has restrictions as to space requirements. Restaurants are now required to stop alcohol services as of 10 p.m. Food service may continue, and alcohol may continue to be sold on a to-go basis. So if people who are sitting there and enjoying a meal and they want to linger later and they want want yet another drink, they can order the drinks, but the drinks have to leave when they leave, and or leave with them when they leave. The reason behind this is that contact tracing has shown that people that congregate in establishments later in the evening have higher instances of physical contact and limited social distancing. Nearly 1/4 of those interviewed by the state show indoor and outdoor dining as a significant source of transmission. And since the beginning of last month, Montgomery County inspectors have closed 4 restaurants and cited 4 for not following the reopening restrictions. And for a regional comparison, so you know what else is going on, Baltimore City no longer allows indoor dining, period. They've restricted it to outdoor dining only. And Anne Arundel County does not allow alcohol to be served after 10 p.m. So everybody is looking at this data. We are all trying to continue to adjust things where we feel that it's safe to adjust and allow more activity. We've been willing to do that. And if we didn't feel safe and didn't feel like we could allow more activity, we've decided to be more conservative. And if we see problems, as in with congregating in establishments late at night, we've decided to be a little bit more protective. And I'll stop there and turn it over to Dr. Gales.
Good afternoon, everyone. Always a pleasure and good to be with you. Just have a couple of brief updates and leave the floor open for questions. First, I want to, again, emphasize the message that we have talked about from the very beginning of the pandemic and throughout, particularly as it relates to reopening our phase guidelines, and particularly in the last week in relation to a number of topics in discussing reopening. We continue to remain committed to the principles of lowering our community transmission and lowering our daily caseloads, because those are the drivers that will allow us to successfully be able to reopen a host of different aspects of society, from businesses to schools to other areas. And the practices that we will continue to implement, consistent with what the county executive just mentioned, are practices that we think based upon the evidence and data that we have available, will continue to drive those numbers in that direction. Now, we have talked about being in a plateau state for the last several weeks. We continue to be in that area with some variability in our daily counts, ranging from, I think in the last week, we've seen a low of 65 to 66 and a high of over 150. And so that average continues to be somewhere in the 70 to 80s range. And we continue to monitor those indicators in addition to our hospitalization rate and a host of other factors to determine whether or not we have continued to plateau or making progress At any rate, we need to continue to see that number come down. And we also not only need to continue to see those numbers come down for our jurisdiction, but recognizing the regional place where we stand in the National Capital Region, as well as in partnership and proximity to the Baltimore area, we need to see numbers come down there as well to help influence our ability to move forward in reopening and making provisions for reopening within our jurisdiction. Now, the other thing, again, I just want to highlight is that we continue to expand testing opportunities. We have stood up a number of other venues across the county. We do have some standing pop-up test sites, for example, in Silver Spring, the use of the Silver Spring Civic Center on Thursdays for the next several weeks. And I'm happy to say on multiple days now throughout the county testing apparatus, we've been testing on a number of days, testing well over 1,000 people during those times. We will continue to look at the data to think about where we need to place those pop-up opportunities to make sure that individuals who are in those highest volume zip codes do have access, easy access to testing, and we will continue to promote those and announce those as they come online. I will stop there and turn it over to Dr. Stoddard, but happy to answer any questions that you all may have. Thank you.
Good afternoon. Thank you. I only have a couple comments before we can go to questions. So we continue to work with both our public and non-public schools on planning around, what can happen this fall. Obviously, we work with MCPS right now. They've made the decision to close through January. We're going to continue to work with them on what available child care options there are, and also what we can do with particularly our special needs students to provide them additional resources to continue their education even through the fall and the remote work. That is obviously very intense planning, because we know that we've established that it will not be safe to be in school environments in great numbers, but there are some resources that can only be done in person, and therefore how we provide them guidance on how they can safely operate. In addition, as we did in our town hall with the non-public schools last week, we pledged to have future meetings, and we're going to begin scheduling them this week to discuss various topics on how they can improve their respective plans for operating when it is safe for them to operate. And so we'll continue those efforts. We continue to work in our recovery framework as well. Our next Community Recovery Advisory Group meeting will be next week, Wednesday the 12th. The topic of that meeting will actually be focused on the child care planning that we are doing. And so that was something that the Recovery Advisory Group itself requested, and we are going to support that request. And so we are working on several things, both with MCPS and our early child care and education initiative partners. And we'll, discuss with them the planning process on what we're working on for child care. It's obviously a very much a work in progress. I don't have specifics that we're ready to talk about yet, but there's a whole bunch of things we're looking to try and accommodate in terms of finding safe spaces for parents who don't otherwise have places that they can place their children safely if they have to go back to work. And so those are all things that we're working on right now. And with that, I'll stop and if we can take some questions.
All right, Dr. Stoddard, thank you. We've got, looks like 6 reporters so far lined up with questions. We'll begin with Tom with Fox 5, who's got a question for the county executive, and Dr. Gales.
Thank you very much for doing the call. I'd like to know that given the governor's order and the federal lawsuit that's now been filed, when are you going to recall the order that private schools cannot open?
Travis?
We're continuing to evaluate the impact of the governor's executive order on the directive that we put out. And as we continue to get feedback on that, we will make the necessary announcements and updates once we have the full complement of data to inform that process. We, as a jurisdiction, separate from that, in all of the actions that we take and will continue to take, are committed to exercising the necessary precautions and putting in the necessary precautions and directives to keep our residents safe.
That was a lot. Could I follow and just ask you, are you not recalling your order now?
As I said, we are continuing to evaluate the impact of the governor's executive order on the directive that we've put out there. And once that process has been completed, we will take the necessary actions and update and announce those accordingly to answer your question.
County Executive, one of the things that was said on Monday when we talked about this was that people needed to look at not only the numbers in Montgomery County, but around the state, because students would come into private schools into Montgomery County from other jurisdictions. But when you look at the 10 metrics on the Montgomery County's own dashboard, all of them are in decline right now, and the test positivity rate is at 2.6% right now. It's at 14 at a 14-day rate. Why do you feel that if people can get tattoos and people can get massages, that they can't send a kid to a religious school?
Well, I don't feel any particular feeling about a religious school. I feel the same way about any school. I was completely supportive of the school system's decision to close the public schools. You get a haircut, a massage, a tattoo, you're in and out. You are not spending 5 or 6 hours in rooms with limited air circulation and less than ideal air circulation that you would design very differently if you were dealing with these kind of health conditions. So we're just those things are just in a different place. And I'm glad you appreciate our lower numbers, but I'll remind you, the only reason we've got lower numbers is that it was a few weeks ago that the governor went one way, and Montgomery County and Prince George's County, to some extent, said we're not going that way. And our numbers have tracked in one direction, and the numbers in the rest of the state have tracked in a different direction. They've turned Ocean City into a COVID bomb with, lots of cases down there in Wycomico County or Worcester County, which I forget which one it is. But, we chose a path to keep people safe, and I frankly think we've done a better job of it.
Kevin Lewis with ABC7 News has a question for Dr. Gales.
Hi, Dr. Gales. I was reviewing Councilmember Andrew Friesen's letter that he sent to you on Monday, and I know there's a number of questions there. One of his questions was, and I'll just read, some daycare centers will operate as kindergarten support classes. Children who would otherwise be in a public school kindergarten will go to these classes at a daycare center, and the daycare center will assist the children with online kindergarten instruction. The question goes on to say, if that can be done safely, is it possible for a private school to safely operate a kindergarten class or any other class as well?
So to answer your question, it's to go back to the principles in terms of why we made the decision in the first place. And why, when we look across the country right now, there's countless and numerous examples of schools reopening and they're having cases and having to close down. The premise behind any of the plans and contingency plans to be put into place are based upon having demonstrated lower community transmission and lower daily caseloads. We have not accomplished that in Montgomery County to date. We've not accomplished that in the National Capital Region to date. We've not accomplished that in the state of Maryland to date, and we certainly haven't accomplished that across the country to date. And those are the principles guiding that conversation and the principles that will guide in terms of what types of other provisions that may be put into place in the interim until we see we have met those criteria and we have met those goals in order to safely reopen. I cannot speak to the specific provision within which Councilmember Friedson is speaking of. I will say that we are continuing to examine the different proposals that have been put into place for schools when they are allowed to reopen in terms of what they look like. And so that is a global answer to your question in terms of what we use as the factors and motivators for our directive, what we are using to guide the decisions related to reopening, and the platform within which we are looking at the respective proposals, that when we have met that criteria for the plans that are being asked to be put into place to keep kids safe.
Using that same logic, do you support or do you think it would behoove the county to close daycare centers so that there's no risk of indoor education and spread this coming school year?
Well, they're two separate bodies. So when we're looking at daycare, so let me take a step back. We are reviewing those same policies as well. We're looking at daycare policies. We're not only doing that here as a local jurisdiction, but the state is continuing to review those proposals and that platform as well. So we're not alone in that because we're evaluating to see if those practices are safe. What's different is there is a scale question in terms of the volume, in terms of daycares being smaller versus bringing entire schools back. And what's also different is that we do have some data points in terms of best practices for child care because they have been continued throughout the pandemic to some degree when they reopened. We don't have any data points for kids within school setting, which are different in terms of the level of activities, the level of interactions, the level of staff, the movement, and different things like that. Because we closed schools down and they haven't been reopened since the pandemic started. And as a reminder, again, here in Montgomery County, when schools closed, including the public schools as well as private schools, we were averaging 4 cases a day. And they have been closed throughout that process. So even in the best settings and the best well thought out plans, the plans aren't unfortunately built upon data because kids have not been in school. And so the ideas that are being put forward are being studied. And again, contingent upon being in a space where we do have lower community transmission and lower daily caseload.
Thank you, Dr. Gales. Kate Ryan with WTOP has a question both for you and the county exec.
Thank you. I had a question about private schools. Dr. Gales, some private schools and parents complained that, had you come to visit them, you would have seen what they've done, that they went to great lengths to protect students. And they also argue they have much smaller classes and larger settings, so they could be safer. So I'd ask you about that. And then to both of you, the call last week in which there was advice given to private and independent schools, did folks raise the objections you're seeing now in the lawsuit? And finally, again, Dr. Gales, I want to clarify, are you saying your order closing private schools stands? It is not rescinded?
So to answer the third question, as to Tom's earlier question, we are continuing to evaluate the impact of the governor's directive, the governor's executive order on the directive that was put into place. When we have completed that process, we will make the necessary announcements in terms of what will happen to that directive and the direction within which we will move. As it currently stands, it has not been rescinded. Now, to the first part of the question related to
assessing private schools.
Yes, in terms of plans, I want to hammer home the point that it is important for schools to have plans. It's important to have plans that, yes, address all of the different components in terms of the different parameters, precautions, and procedures that need to be put into place for schools to be effective and safe. The big message, however, is that in order for any of those plans to be successful, they must be in the setting of a jurisdiction with low community transmission and lower daily caseloads. And when you look across the board, when you look at the CDC guidelines and webpage in terms of metrics and guidelines for school reopening, they explicitly say one must also look at the jurisdictional and the area epidemiology and surveillance data to determine whether or not it's safe to move forward. And in order to successfully do that, that must be in the setting of, again, low community transmission and low daily caseloads. Again, we have made significant progress in Montgomery County in terms of moving to a point where we are seeing lower cases and sustained lower cases, sustained lower test positivity, and sustained lower indicators across the board on our dashboard. But we have not achieved that here in our county. We've not achieved that in our region, and that's important because, as was pointed out by the county executive, particularly for private schools, we do pull students and staff from numerous other jurisdictions across the region and across the state. And even though our numbers have improved, we've not achieved that goal here, we've not achieved that goal in the region, and we've not achieved that goal in the state. And so, yes, plans are a part of it. And we have said, going back to our conversation Wednesday, we will work to provide more advice in terms of how to do that safely what types of things need to be included in contingency plans and safety plans once schools are reopened. And that may create the opportunity to be able to do some site visits to see what schools have in place. But all of that is contingent upon being in a jurisdiction and in an environment where there is sustained demonstrated low community transmission and lower daily caseload. And that is what we are seeing happen across the country, where we have seen schools reopen, where those criteria have not been met, and schools have had to be closed due to students testing positive, as well as staff members, teachers, and administrators testing positive within those environments.
And the county executive, is his mic, is he available? Okay.
I'm here. You guys not see me?
There you go.
So,
No, so again, I just wanted to check with you on the call last week and what Dr. Gales was advising to private schools. Did you hear many objections?
No.
And again, did you get anyone who said, any of the private school, either teachers or staff, who said you made the right call?
So I'll jump in and say this. So, and Dr. Stoddard also participated in the call that we had. We did not get, as best as I can recall, any of the comments in terms of objections at that point to the level that have been expressed over the weekend and early this week. We have subsequently received a number of feedback from those who have not been happy with the decision. And we've also received a significant amount of feedback from individuals, from parents, staff members, teachers, and students who have said, thank you for the decision. We do support what you all have put into place.
Okay. We ready to move on to Rebecca Tan, who has a question for Dr. Gales?
Yeah, muted.
Rebecca with the Post.
She's muted.
She's muted.
She's muted. There you go.
Thank you. Thank you. Hi. Thanks for having the meeting. I appreciate all the responses that you've given so far, Dr. Gales. But I know that, Governor Hogan's order was given on Monday. I'm wondering, in the days since, can you share a little bit more about what the county has learned about how his executive order might affect your directive? What do you guys know as of now?
I'm not at liberty to comment further than what I've stated already in terms of we're continuing to review the governor's executive order, and I'm not attempting to be dismissive at all, but that's what I can share, that we're continuing to review the impact on the directive, and once that process has been completed, we will make, the necessary announcements, and it will be clear in terms of what direction we will be taking at that point.
And just a quick follow-up to that, too, if that's okay, Julie. So, since the directive does still stand, private schools that do open before the deadline of October 1st, they still stand to face the possibility of a $5,000 fine. Is that right?
Yeah, so the directive is clear in terms of that. And our goal, again, one thing that I think is being lost in this conversation, and it is a little frustrating actually, is that the purpose behind what we're doing is to keep kids safe and to keep staff members safe and family members at home who may be impacted when kids and staff members come. And so the policies, what we're asking is that we have time to allow for us as a jurisdiction, a region, and a state to demonstrate lower community transmission and lower daily caseloads to get to the point where we can feel comfortable and confident that schools can reopen safely due to a lower level of virus within the community. We have countless examples, unfortunately, that are popping up every day of jurisdictions where we are seeing that they are opening and they're having to close within the first week. We're not making any of this stuff up. We've seen it in Indiana. We've seen it in Georgia. I think this morning it was announced that 80 cases of students and staff members impacting over 20 different schools. I think that's the correct read on that. 20 different schools who've had to close within the first week of reopening. We've seen it even as close by in Fauquier County, where they were intending to bring back teachers and staff next week, and they've had 2 administrators who've tested positive, and now that has been put on hold. So the reason why we've taken the actions that we've taken is we are looking across the country. We're looking at the data here that suggests that the viral load is still too high within our community to be able to safely reopen schools during this time period. What we are asking is that we, with extending the deadline or extending the start date for in-person schooling, is that allows us to, as a jurisdiction and as a region, as a state, to be able to move in that direction where we have sustained lower community transmissions and lower daily case volumes, so that we can begin to open schools utilizing the well thought out plans that schools have put together, that we will continue to work with them to provide advice to ensure that they have thought through all of the different parameters and necessary permutations. I recall the work that we did that has been very public with how we worked with the public school system. They had a very extensive plan that anticipated a lot of different scenarios and things like that to safely reopen. But they made the call based upon the advice that we still had too high of a viral load within our community to safely reopen, even with those particular plans in place.
Aisha Khan with Fox 5 has a question for the county executive.
Thanks. You guys can hear me?
Yeah.
Okay. County Exec, I apologize if it sounds like a repeat question, but a little different than what Tom had asked you. But if Montgomery County is doing well by all measures, why then do we have to restrict alcohol sales, but then allow other contact services like tanning salons and waxing and threading, massage and tattoo parlors to open? And the second question, just because I'm not going to have much time, why is playing soccer or soccer now on the high risk category?
So I'm going to try to separate this into 2 parts. There's just no equivalency between getting a massage or getting your fingernails or toes done and sitting in a room all day long. There's just absolutely no equivalency of those 2 things. And we looked at data, and the contact tracing, which is not something that was available in the beginning, has become available now, and we can begin to see patterns. We don't see a pattern of people getting infected from having their toenails done. We do see patterns of people getting infected from congregating in larger groups, and we know as a county that the late night environment is hard to control, and we don't have enough people to put in every single bar and restaurant to assure that things are done exactly as they're supposed to be done. And the truth is, they're not always done exactly as they're supposed to be done. So out of an abundance of caution, we've made some decisions to be a little bit more restrictive because we felt that was necessary in order to maintain our good numbers. And this question, I'll share Travis's frustration. We have good numbers because of what we did. This is not like, these numbers dropped out of the sky and suddenly cases in Montgomery County disappeared and went away. The reason we've been able to change our trajectory is because we chose a path that opted for maximum protection of our citizens. That's the choice we made. And we based it on the medical evidence. I don't make these decisions. I talk with Dr. Gales. He talks with other health officers. I listen to the guidance they get, and ultimately it's his health decision, and that those things then get reinforced with an executive order. But the evidence is that this is the right thing to do, and I'll tell you, if you like our numbers and you want to write about how good our numbers are, then give us credit for what we did to get these numbers. And people need to be disabused of the idea that we just have good numbers for no reason at all. Because if we were looking about a month and a half ago, this region at that point was over 50% of the cases in the state of Maryland. So we made decisions that changed our trajectory, and we intend to stick by the kind of decisions that made it possible for us to get where we are. And if we were allowed to continue to do this, we would be able to open up more things. I think the things we decided to open up this week are indicative of the fact that we're actually looking at evidence, and where we see opportunities to provide more business opportunities, and we determine that it doesn't have a high risk to people, we're more than willing to do that. And while all this is going on, the data on children and transmission is actually getting worse, not better. What they're showing is the kids can carry higher viral loads than people assume, that they can be more effective transmitters of the disease than people assume. So it's not just a matter of what happens in the classroom, but it's a matter of what happens if the kids get infected, if they're not symptomatic, if they go home, if they go out to play with kids in the neighborhood. This is how spikes start. And we want to make sure that we're not providing we're not facilitating the ability of spikes to restart in Montgomery County. We're trying to basically get this infection out of the county. And we're not going to do it if we're not serious about treating all these potential risks seriously.
And does that part of my soccer question? I guess why soccer is now in the high risk category.
I can't speak to high risk or medium risk, and maybe Dr. Gales can, but I'll say soccer is a contact sport. It is not something that you play without coming into close contact with people, and it's, the state issued guidance on sports. I think this guidance on the soccer makes sense, but Dr. Gales can add to that if he wishes.
Well, I think Dr. Stoddard was going to comment on the soccer piece, but once he does it, I do want to come back to another point that you made, Aisha, that I think is important to emphasize. Dr. Stoddard?
I was actually going to bring up another point, but I'll talk about soccer. So we're going to take a look at soccer. We're going to look and see about I think we're going to have a conversation around there are different views depending on what literature you look at about how they define soccer. And so we're going to look at both views, and I think that's an area where we could, based on community feedback, take a look and decide, make some decisions around. I'm not promising that we're going to remove it from the high-risk list, but we did promise yesterday to County Council to take another look at it, to review the data again to see where that stands. What I did want to comment on is last week the governor talked about the top areas associated with cases via contact tracing. The top 4 areas were gatherings at 44%, which we have a more strict gathering limitation than any other county in the state. Number 2 at 39% was retail. We limit our retail to one customer for every 200 square feet as opposed to an occupancy limit the state has. 3 was indoor dining at 21%. 4 was outdoor dining at 21%. So those were the areas based on data we said, hey, we maybe need to do a little bit more than that. So based on that data and our experience with enforcement and education, we saw that compliance in our restaurants erodes as the evening goes on, and it erodes at a rate faster in the places that do alcohol sales more aggressively. And therefore we said, rather than doing what Baltimore City has done, because our numbers didn't support being that stringent at closing indoor dining, for example, we decided to target that degradation in behavior because of consumption of alcohol. That's not to say that at some point in the future our numbers may not improve and we can rescind that, or get worse and we have to go farther. But our point was to be very specific in targeting where we see problems and where the data says there are problems, rather than attempt to be more aggressive in a way that other jurisdictions have had to be because of their numbers.
And to the other point that you made, Aisha, we have to be very careful about how we talk about and characterize, our improvements in numbers. None of this is successful. I mean, yes, we're making strides and we're seeing improvements and we're making positive progress, but it's not the end of the game. And so I don't think any of us within public health, emergency management, any of the other stretches of Montgomery County who are responding to the pandemic are happy and satisfied with 60 to 70 cases a day. And the actions that we're continuing to take are the tools that we need to take to drive that down even further, to again get to a place where we are seeing lower community transmission, to be able to reopen some of these different activities, again, whether it's school or restaurants or different types of sporting events. When we look at other countries who have been able to move forward, particularly as it relates to schools in terms of reopening, they have had significantly lower transmission rates and significantly lower daily caseloads. which suggests that if you meet those criteria, you can more successfully be able to reopen those particular parameters. And I think it's important to also emphasize that, unfortunately, when we look at a number of states who have seen significant surges right now in the last month, a number of those states were enjoying fairly lower levels, kind of where we are right now. And they opened up a little bit too quickly, and also without the necessary restrictions and provisions in place. And we see how quickly that a few cases can spread significantly, and then you're impacted by an exponential increase. So yes, as the county executive mentioned, we are happy with the progress we've made, but we are not celebrating that and resting on our laurels in a sense of complacency to say we don't have tremendous work to do beyond that to get the numbers to drive down even more.
Caitlynn Peetz with the Bethesda Beat has a question for the county executive and Dr. Gales.
Hi, I think my question might be more geared toward Dr. Gales now that I'm thinking about it, but the county executive can weigh in if you'd like. First, I just have one quick clarification point. Dr. Gales, you said that the county is reviewing the governor's order about public schools and you'll take actions after that. But do you have any anticipation of how long that review will take?
I don't want to sound like a broken record, but we're continuing to evaluate that. And as soon as that process is completed, I hope that process will be completed soon, we will make the necessary announcements to you all and to the public in terms of the next steps.
Is that it, Caitlin?
No, I have a question as well. Thank you. I guess my question then, assuming that the governor's order does, overturn your order or override that, and knowing that you don't believe it is safe at all for schools to reopen at this time, considering the caseload and transmission rate, what's next for you then? What do you do at that point to keep those non-public students and staff safe from your perspective?
Well, regardless of how that shakes out from a legal perspective or that kind of thing, we, again, remain committed to putting in practices and procedures that are keeping our residents safe. And we will continue to look at the complement of options that we have available in order to make sure that that is done and that is accomplished. And again, I want to emphasize the reason why we're making these decisions. There is no political agenda. There is no, I know we receive lots of questions about conspiracy and things like that. We remain committed to achieving and establishing an environment and a jurisdiction that demonstrates, are you ready for it? Lower community transmission and lower daily caseloads to demonstrate that we have lower impact of the virus in our community in order to be able to safely reopen our schools and reopen other aspects of society, including businesses, personal services, sporting events, arts, entertainment, those types of things.
Okay, Randi Bass with WDVM has a testing question for Dr. Gales.
Good afternoon, everyone. Thanks for having me on the call today. To Dr. Gales, a few weeks ago, the county outlined several testing goals and objectives it was trying to meet. Where are we in terms of meeting or approaching those targets? And if we're not there, what's it going to take to get us there?
Sure. Good afternoon, Randy, and thank you for your question. So we have a very ambitious testing agenda, and you all are well aware of that. And we've talked about our goals and desires to scale up and ramp up testing as much as we can. And even though buffets are closed, or I think they should be closed in most places during the pandemic, we're continuing to expand and increase options on our testing buffet. And so within that, again, we've got our regular sites that we've had in place for months now. We're extending the hours of availability. We're adding 2 additional sites in Gaithersburg and Wheaton area. Again, fingers crossed that they will go live within the next week. We also have the ready responders who are coming in testing on site and homes. We have our mobile test team being able to support with assisted living facilities and nursing homes. And may I add that the state has, I think within the next week or so, will no longer be supporting the nursing homes and assisted living facilities to achieve testing. And so we are working with those venues to be able to help support them so that their residents and their staff members will have access to testing within those particular venues. And so we also continue to work and expand partnerships with employers across the county to be able to provide testing for their workers, both for non-county agencies as well as within the county portfolio. So we are scaling up significantly. Last week we had a goal of testing just shy of 5,000 folks as a part of the county testing apparatus. We superseded that and went past that. Now, we may be a little bit challenged with accomplishing that this week, given that we were influenced by the weather yesterday and today, and so we've had to reschedule some test events and some of the test sites. But I'm confident we're moving in the right direction. We are continuing to add on partners and be able to also support different community agencies and venues in terms of being able to provide testing in their respective places of business also.
Kate Ryan from TOP has a follow-up question regarding soccer.
I think you may have answered this in part to Dr. Stoddard again, because the question yesterday was, well, if lacrosse and field hockey, which you could also argue are very much contact sports, are allowed, then why would soccer not be allowed? Again, you're saying it's going to be reconsidered?
We're going to take a look at the data. I mean, we promised this to County Council. We constantly look at the data. There are, depending on the source you look at, soccer is classified multiple ways. The state report around safely reopening sporting does classify soccer as a medium risk sport. We have seen there are other sources from the collegiate level that define soccer as a high risk sport. And so we're going to go back and take a look at the data that got to both of those conclusions, and simply we're just committed to reevaluating it based on the request from the County Council. I don't want to pledge that we're going to include soccer. I don't want to pledge that we're not going to include soccer. We just are going back and look at the data based on the two different reports that we have before us.
Okay, Judy with the Greater Olney News has a question for Dr. Gales and or the county executive.
Thank you. Given that the governor for many months has seemed proud that he has given jurisdictions the authority to do what is best for their residents, provided it didn't go beyond what he has given the authority for, were you shocked? Were you surprised? What was your reaction to his executive order, or did you expect it to come?
I would defer to the county executive to comment on that further.
I was surprised. I didn't think it was appropriate. I don't think it's supported by data. It makes no sense to have a policy, to on the one hand say, I'm perfectly fine with the entire public school system of, every county, that wants to close it to close. And then on the other hand, just say I'm okay with private schools opening. There is no logic. A private school teacher, a private school student, a private school parent, a private school custodian, they are the same human beings who could be in public schools. So the fact that he felt it necessary to do that rather than let us continue to come up with what we think are the best and safest solutions for people is beyond me. And every complaint that I've heard is applicable to the parents of public school kids. If it's hard because you want to go back to work and now the kids are going to be home from school. I got 165,000 public school kids for whom that's going to be a problem as well for their parents. So I don't understand the separation of the problem as more serious for one group than another group. And it just kind of shocked me. I thought, by and large, the governor has been ahead of the game compared to many other jurisdictions. I think of late there's been some slippage, and I'm not the only person who feels that way. I think, the decision in Ocean City was a big mistake, not to have been more, if you were going to open it, not to have put more requirements on it. And I think his decision on private schools is not a good decision. And I wish he would let us continue to work through this problem so we can get numbers down. So then we open the schools, we're not going to be sitting there, waiting to see, do I have to close this again, waiting for the first big incident to come around and say, my God, we made a mistake. We've got to go back now. I know it's not easy. I'm a former school teacher. I have, trepidation about, what's the best form of instruction. I'm not confused about what's the best form of instruction, but I'm weighing the best form of instruction against the best form of protecting the public. And unfortunately, that's the kind of decision where you've got to protect the public first. And that's where I sit on this.
Final question of the day is from Glynis, who I believe is reporting for Maryland Matters regarding non-public schools, and that is for Dr. Gales.
Sorry, thank you, Julie. I'm actually with the Baltimore Post-Examiner for this phone call. I responded to your note. This is for Dr. Gales. Dr. Gales, I'm trying to understand the structure for private school reopenings. Did private schools send you plans for reopenings, or did they not really interact with you a lot on the county level and worked more with the state with regards to restrictions and guidelines they wanted to put in place for the coronavirus?
Well, I think there's a little bit of variability within that. So we did have a handful of schools reach out after the public schools make their announcement. I think, and there were a handful of schools, like maybe like 2 or 3, who reached out, not necessarily to me, but reached out to our licensing and regulatory staff to say, hey, we were thinking about reopening. Here are some plans. We also received some concerns from some families and staff members of some schools who I guess had received communication from their schools about reopening, and they had concerns about the level of safety within the plans that were shared with them. And when we received that feedback, we had a conversation to say we recognize that up until that point, we had not had any extensive conversations with any of the leadership, or actually any conversations at all with any of the leadership within those respective organizations, independent schools, archdioceses, etc. And that is what was the impetus behind putting together the town hall that we held last week. Again, myself and Dr. Stoddard participated in that, and we created the opportunity for school staff members and the like to submit questions or concerns or feedback about what they were doing within their respective schools. And in that process, it was very clear in looking at the scope of the questions provided and the concerns and comments provided that there were significant gaps in terms of the level of knowledge and understanding. This isn't making any negative comment at all. It's just that there's a huge body of knowledge when it comes to COVID and when it comes to the types of procedures that need to be in place. And it's one thing to say, hey, we're going to keep students apart, but physically having mapped out plans that show how you're going to do that within your classrooms, within your restrooms, within your hallways, that level of specificity and detail. And part of that was, again, that's why we wanted to have that conversation. And we also, as part of that conversation, recognizing the gaps in knowledge and the gaps in the level of specificity of plans on all of those different aspects, we talked about creating a mechanism, which we're working on right now, to be able to provide feedback to schools from a global sense in terms of providing, whether it's through webinars, doing a COVID-19 101, or this is what happens if someone tests positive. Here's what the contact tracing process is, and what does that look like impacting our schools. So we've made a commitment to do that. And I know also at the state level, the state is working on providing guidance as well for non-public schools, similar to what they have provided for public schools through their Road to Recovery roadmap.
And our final question of the day is from Pamela Wood with the Baltimore Sun. She's having some audio issues, so I will just read for the county executive specifically her question. And that is, Mr. Elridge, have you spoken with Governor Hogan about Dr. Gales' public health order regarding non-public schools?
No, I haven't spoken to the governor. I will be, I think today I'll be on a call with the governor's staff, but he no longer attends those calls. So it'll just be a call with the staff. I will be sure to at least let them know how I feel about it. Because if I'm not going to waste that opportunity to express, my feelings on this. But he has not spoken to me, and haven't spoken to him.
All right, and that will do it. Thank you very much for this robust conversation. We have reached the 60-minute mark. We appreciate you joining us here today. And if we don't see you sooner, we'll see you back here next Wednesday at 12:30. Thank you.